human body relies on intricate networks of nerves to transmit signals between the spinal cord and the limbs. Among these, the brachial and lumbosacral plexuses stand out for their complexity and importance. These plexuses are responsible for carrying sensory, motor, and autonomic information, ensuring that our arms and legs move and feel as they should. When a disorder affects these plexuses, known as plexopathies, the consequences can be profound, often impacting large groups of nerve fibers and resulting in significant disability. Diagnosing plexopathies can be challenging, as their symptoms may overlap with other nerve disorders. Electrodiagnostic studies and advanced imaging like MRI and high-resolution ultrasound have become essential tools for confirming the presence and extent of these injuries. In this video, we'll explore the anatomy, causes, and clinical features of brachial and lumbosacral plexopathies, setting the stage for a deeper understanding of these complex conditions. Let's begin with the brachial plexus, a network of nerves originating from the C5 to T1 spinal roots. This plexus supplies the shoulder, arm, and upper chest with both movement and sensation. Anatomically, it's divided into roots, trunks, divisions, cords, and terminal branches, each playing a unique role. Disorders of the brachial plexus can arise from traumatic events, like high-speed accidents, sports injuries, or even surgical complications, or from non-traumatic causes such as metabolic, inflammatory, or neoplastic processes. Clinical features depend on which segment is affected. Upper trunk injuries may cause weakness in shoulder and elbow movements, while lower trunk lesions often impact hand function. Diagnosis relies on a combination of clinical examination, nerve conduction studies, and imaging. Understanding the anatomy is crucial, as it guides both diagnosis and treatment, which may range from physical rehabilitation to surgical intervention in severe cases. Moving to the lower body, the lumbosacral plexus is formed by the anterior rami of the L1 through S4 nerve roots. It supplies the legs and pelvic structures and is divided into upper lumbar and lower lumbosacral plexuses. While less complex than the brachial plexus, it is equally vital. Disorders here can result from trauma, tumors, diabetes, or inflammatory conditions. Patients may experience weakness, sensory loss, and pain in the legs, with symptoms varying based on which part of the plexus is affected. Electrodiagnostic studies are essential for confirming the diagnosis, especially since routine nerve conduction studies may not assess all segments adequately. Imaging, particularly MRI, helps identify structural causes like tumors or hematoma. Recognizing the clinical patterns and combining them with targeted diagnostic tests is key to managing these often disabling conditions. Accurate diagnosis of plexopathies requires a multifaceted approach. Electrodiagnostic studies, including nerve conduction and electromyography, are invaluable for localizing lesions and distinguishing plexopathies from other nerve disorders. Imaging, especially MRI and sometimes high-resolution ultrasound, can reveal structural abnormalities, nerve injuries, or masses compressing the plexus. Laboratory tests may help identify underlying metabolic or inflammatory causes, though their role is often limited. Treatment depends on the underlying cause. Trauma may require surgical repair or nerve grafting, while non-traumatic cases often focus on symptom management and rehabilitation. Early intervention is crucial for optimizing recovery, and in some cases, surgical approaches like tendon transfers can restore function when spontaneous recovery is incomplete. Ultimately, a tailored, patient-centered strategy is essential for improving outcomes and quality of life for those affected by these challenging conditions. Brachial and lumbosacral plexopathies are complex disorders with significant impact on limb function and quality of life. Their diagnosis requires a high index of suspicion, careful clinical evaluation, and the use of advanced diagnostic tools. Understanding the anatomy and typical clinical presentations is fundamental for accurate localization and management. While traumatic causes often necessitate surgical intervention, non-traumatic plexopathies demand a comprehensive approach that may include rehabilitation, pain management, and when indicated, immunotherapy or cancer treatment. With ongoing advances in imaging and electrodiagnostic techniques, clinicians are better equipped than ever to diagnose and treat these conditions, offering hope for improved outcomes and restored function.